Hey guys, I'm Dr. D'Souza, and I've come to talk to you guys about obesity and weight loss. As you know, we have our obesity weight loss clinic. It's just beside Kroger. As you approach Kroger, it's to the right, and Dr. Chapman, Dr. Bob Schumann, and myself have come together to try and help people to lose weight. Now, as you know, obesity is a major problem, not only for us in America here, but all over the world. As we start eating more and more refined food, and as we eat food that is sweetened with fructose syrup, you know, the dice is loaded against us. Also, as part of the industrialized world and the industrializing world, we're just going to have much less exercise, and the net result is we get bigger and bigger. And that causes all types of problems. It causes sleep apnea. It causes weight on your joints. It causes diabetes. These are just to name a few of the problems that it causes. So if we can get rid of the weight, it will help all these problems. And in addition, it will also help you look better and feel better. Now, what we do is in our clinic, we've been talking to people. I mean, I've been practicing medicine in Lawrence County for 15 years, and it's very easy to tell people to lose weight, but believe me, it's the most difficult thing to do. And all of us have our various different problems and stuff like that, but we've got to make that commitment and we've got to lose that weight. That's the first thing. The second thing is, when you come to the clinic, we have pharmacological support. That means we give you a medicine to totally cut your appetite. Now, this medicine is FDA approved. It's phentermine. It will totally decimate your appetite. Now, while we have you on this medicine, we will change your diet. And we have a diet that has been crafted by dietitians. And what this does is, what we want you to do really is just change your lifestyle. So, like I tell people, phentermine is not forever. We do not envisage putting you on phentermine for a very long time. But what we do want to do is just help you to change your lifestyle. And the three of us being physicians, having practiced in Lawrence County Dr. Schumann has been there for 40 years in Lawrence County, and both Dr. Chapman and myself have been here for about at least 15 years. We have really good expertise in handling diabetes and managing the other problems that go along with obesity. So once you start losing the weight, we know how to adjust your diabetes medications. It will be a much rounded, wholesome approach to obesity. So coming back to the medications and diet. So we put you on, there's a 12-week program where for the 12 weeks we give you this phentermine. People have lost upwards of 30 to 40 pounds. This is just an average weight loss that we've been seeing in our clinic. Hopefully, we'll get you to lose 80 or 100 pounds, people that are morbidly obese. Now, there are some other treatments for obesity, including surgical treatments, but this is probably the best if you change your lifestyle, because we've seen, even after gastric bypass surgery, after people have put themselves through so much risk, they do lose about 100 to 200 pounds, and then they start eating again because they haven't really changed their lifestyle. So lifestyle change is the most important. And you guys need to know this, that you're not alone. I mean, I've been struggling with my weight every day of my life. And it's so easy. When you go to work, people bring different kinds of sweets, you know. They're really delectable, these sweets, and there's the temptation to just take a bit of cake, put it in your mouth, and you forget about that. And although I've been exercising every day for the past 30 years, it has been very difficult for me to lose weight till I made a commitment last year. And I said, I'm going to watch what I eat. Now, I did it without any medications, but it was extremely, extremely tough. But that's what you need to do. Come up with a commitment. Make up your mind, I've got to lose that weight, and then we're there to help you. And as you know, obesity is not really cheap. I read an article just yesterday, and it said that the United States spends $150 billion on obesity-related morbidity and mortality. So what we want to do is we really want to change the way we practice medicine, and I see this as a big step forward, losing weight. What we also will be able to do is we will be able to save on the medication cost. If you can lose 30 pounds, we can take you off of your insulin. If you lose 30 pounds, we can take you off of Actos, and Actos is so expensive. It costs anywhere between $100 to $160. And wouldn't it be better if we can get rid of diabetes totally? What you really need to do is make that commitment. Just pick up the phone and call us. We're there for you, and we have a full support team. On Mondays, Dr. Schumann has this lectures where he brings a speaker. There's free food, free healthy food, and hopefully you'll join. We're right here in Dublin at the Kroger Shopping Center, so make that commitment now. Pick up the phone and call us. The number is on the screen, and let's tackle this problem together.